Well, welcome to Freedom from Pain. I'm going to share with you a really amazing, incredible case. Okay, can diabetes be cured? People with thyroid problem, asthma problem, legally blind in one eye and totally blind in another eye, and need people to help you with grocery shopping, laundries, and you walk sideways on the sidewalk with a walker because you're afraid that you may step down. You cannot see the depth of the curve, okay? And she was taking over 120 units of insulin, okay, and her blood sugar is still 200 to 300 high. Is there hope for people like this? I'm going to have Ruth tell them the story. So tell us, how do you first came to see us? What kind of problems were you suffering before you come to see us?
Well, you explained some of them. I had to have a caregiver, and I could hardly see at all to maneuver. And I'd like to tell you that, yes, my blood sugar was very high before. It could be up in the 200s, and my blood pressure before in the emergency room was in the 300s. But now I've lost 39 pounds, and I have treatment here, and my blood sugar has really come down. This morning when I took my blood sugar, it was 134 before I made the trip out here from Silver Lake.
One thing at a time. Let's talk about your diabetes, okay? How much insulin were you taking before you came to see us?
37, 24 in the morning, and like 27 and like 18 at night.
Okay, 37 and
20, 24, and let's see, 37 and 27. In the evening, it was 24 and 18.
Okay, so like 60-some units in the morning, and almost as much at night.
Yeah,
so
almost.
over 100 units of insulin, and your blood sugar is still
in the 200s.
200. Okay, and now you take how much insulin you take?
I take 4 in the morning and 4 to 6 at night.
And what's your sugar now?
134 when I got up this morning.
134. Okay, it's almost normal. Okay, you can actually cut down even more. Okay,
yes, I can.
Afraid. There's a recent study showing that if you are too aggressive using pills and insulin to try to cut the sugar more to normal, actually the death rate goes up. So you don't want to be too aggressive on pills, especially. That's very hard.
I don't take any R anymore. They're really bad insulin.
So you would.
I just take N right now.
Okay. Now, so how about your blindness? What your cataracts cause?
Well, everybody can tell you that before I had cataracts, and I couldn't see anything out of this eye, and I was legally blind out of this eye, and I used a red and white cane. When I first came here, the day I came here, I could not cross the street because I could not read the "Don't Walk" sign. I actually had to wait until another person came to follow them across the street. Today, I can cross the street. I can see the "Don't Walk" sign. I know it sounds incredible and amazing, but it is true. I go a lot of places by myself now that I never could have gone before. My son wants to meet Dr. Tong, and that is incredible itself.
Ruth, let's talk a little more on detail, your disabilities from your blindness, okay? Were you able to vacuum, do your laundry prior to our treatment? You had cataracts on both eyes.
I had a caregiver who came in my house to help me do all those chores. It was very depressing that I couldn't do these chores myself.
Yeah. Were you able to find the on-off button on the? You told me you were not able to find the on-off button on the vacuum machine, or find the coin on the drug.
I couldn't even plug the vacuum cleaner in. I could not even match up the tongs or the tines on the plug to put it in the wall. I could not even see the coins or anything on the floor that I would vacuum over, and then I would rest my belts on my vacuum cleaner.
Okay, so you said that you were using a walker and you walk sideways on the sidewalk. So how can you come to see us from LA?
Well, I got access to bring me to Disneyland. At the time, they didn't have Orange County access up here, so I took access to Disneyland, and I had somebody help me across the street, help me to the bus stop, the 43 bus stop to Costa Mesa, and I took the hour bus ride out here, and thank goodness you're only across the street from the bus stop. But I had not calculated properly the hour ride back to meet access to take me home to Silver Lake in LA. So I was there devastated that I had no access because they had already left. And I actually had to get the bus back to LA.
So how long do you take one way to come to see us?
So sometimes it takes 4 hours.
So Ruth, so we take you 4 hours one way, and you've been coming to us 3 times every 2 months for about 2 years. Is it worth it?
It's over 2 years now.
Over 2 years now. Okay, so tell us some of the improvements. See whether you think it's worth it. If it's worth it, why?
Because I'm happier, because I can see, I can get around, and I can do my own laundry, I can do my own vacuuming. I still can't do my own grocery shopping. I have somebody to help me there.
Okay, so now you can plug
It's a different world.
Now you can see the plug to plug it in.
Yeah.
You can see the coins, and so you don't actually suck the coin in the vacuum cleaner.
I can tell the difference between a quarter and a nickel.
Quarter and nickel, okay. And you told me during treatment that you can see the location and the time on the bus,
I can read, when I get on the bus, I actually can read up in the blinking lights that the day, the month, the day, and the time.
Yes. Okay. But by improving the circulation to your eyes, we restore your eyesight. So today, okay, your totally blind eye now is as good as the other one in the beginning.
Right.
And the right eye is a lot better.
Amazingly better.
Yeah. In fact, if people look at the way you skip around, okay,
yeah.
Without anything, nobody will know that you are blind.
I remember the first day I could read the clock on your wall over there. I was so excited.
That was not when you first came.
Not when I first came. That
yeah.
was just, what, 2 months ago?
Uh-huh.
When I turned around, it was 10 to 2.
Yes, okay. Now, also that you used to fall a lot. You fell 11 times in 2 years, and 3 of those times you need the emergency room treatment. Okay?
And I didn't have Medi-Cal, and I ended up paying it all off.
Okay, so you had a lot of back pain when you first came to see us?
Awful.
Okay. How long did it take for me to help you with the back pain?
Right away.
First treatment?
The first treatment, I could bend over and touch at my toes, not my toes, but I could bend over without pain. It was just, I was just odd that you could get me away from that pain and I could bend over. I thought I'd never touch my toes again.
So how long have you had that pain before I treated you?
I had 5 accidents since 1985, and I suffered a lot.
85, okay, 95, like 20 some years.
Yeah.
And you have pain all those times.
Yep.
And you fell 11 times the last 2 years.
Yep.
Okay. And you said that you could not bend over and put on your socks for how long?
For ever since 85, when I messed up my back, I haven't.
Decades.
I've been wearing thongs.
Yeah, for decades you could not put on your sock by yourself, and then you're in pain. And then after my first treatment, the pain was gone.
Right.
And you could bend over.
Yes.
And how many times have you fallen since I treated you?
None.
None?
None.
Okay, so this is the amazing part. Okay, once you restore the circulation, okay, the problems are all gone. What else should we talk about? Like your incontinence you had before.
I used to wear diapers.
You used to wear diapers.
It was very discouraging. I had very bad bladder problems.
Yeah, how about now?
If I come out here, I will wear a pad just in case. But you helped me a lot with regard to the bladder and the dribbles.
So at home you don't need to wear anything.
Yeah.
Okay, so it's just like normal.
No.
Okay, so only when you go out. Okay, so
when I go
we
out,
can treat incontinence. It's quite simple. Improving circulation to the bladder sphincter, gut circulation, and can hold the urine. Well, in summary, this is a basket case before Ruth came to see us. Now it's back to school. So you can see her diabetics, but diabetes is almost normal on 4 units of insulin occasionally. You're not taking it every day, right?
I take the 4 units in the morning. But if I don't need it at night, if my blood sugar's okay, I don't take it at night.
One of the reasons is that Ruth only receives 3 treatments every 2 months. That's how much Medicare pays. Okay, if she were able to get treatment every week, her diabetes would have been cured by now. So eyesight would be a lot better. Okay, but this is our system. In spite of that, 3 treatments every 2 months. She had improved this. Now she is a very productive citizen instead of like a basket case that in getting disability from the system.
I'm depressed.
And depression. So how much is the depression improved?
I'm very happy now compared to before.
Before you were depressed, yeah.
Very depressed. I had no hope.